Hello students, welcome to my YouTube channel. Today I am going to discuss about the topic is vital signs. Vital signs is a very important topic. It is a very most basic procedure for the nursing, and it is a very important. It is asking for the exam also. Vital signs means you have to clear or you have to remember body temperature, pulse rate, respiration rate, and blood pressure. These four main points you have to remember. Okay, vital signs means body temperature, pulse rate, respiration rate, and blood pressure. Okay, vital signs are measurement. Vital signs are measurement of the body most basic function. The four main vital signs routinely monitored by medical professional and healthcare providing, including the following. Okay, vital signs are measured for basic for most basic functions. What is most basic function we have to assessing? It is included, it is checked by the medical professional or healthcare provider, okay, including the doctors, nurses. We have to check in the vital signs, mainly body temperature, pulse rate, respiration, and blood pressure. And vital signs are useful detecting or monitoring medical problems. Vital signs can be measured in medical setting, home, at the medical emergency or elsewhere. Okay, this is mainly we have to detect in either medical problems के लिए we have to mainly checking for the vital signs. It's a basic function. If any other changes occur, suppose temperature, uh, respiration, BP, in this vitals we have to any other changes maybe increased or decreased. Okay, it is a reason for the any other problems or internal. Suppose BP increased, it's related to the heart problem. Okay, respiration may be increased or decreased, maybe not getting. It's related to the lungs, related to the problem. So basic functions हमारे basic organs का functions को assess करता है, because करता है this vital signs. Okay, this assessment of vital signs provide specific data regarding current condition. Correct provide correct data पेशेंट का करेक्ट क्लाइंट कंडीशन को हमको भी आइडेंटिफाई कर सकता है. वेरिएशन फ्रॉम बेसलाइन वैल्यूज में इंडिकेट पोटेंशियल प्रॉब्लम विथ हेल्थ क्लाइंट हेल्थ स्टेटस. ओके, इसका वेरिएशन में नॉर्मल वैल्यू से ज़्यादा और कम, दैट इज कॉल्ड वेरिएशन ऑफ द बेसलाइन वैल्यूज इंडिकेट पोटेंशियल प्रॉब्लम्स. एक सीरियस प्रॉब्लम भी हो सकता है. ओके, and this is mainly purpose देखो to assess the health status of an individual. हेल्थ स्टेटस असेस कर सकता है, टू प्लान इम्प्लीमेंट द नर्सिंग केयर. नर्सिंग वी हैव टू प्लान कर सकता है. अगर कुछ बीपी इंक्रीज और टेम्परेचर इंक्रीज हुआ है तो इसका भी लिए हमको भी ट्रीटमेंट देंगे. टू अंडरस्टैंड द इफेक्टिवनेस ऑफ द ट्रीटमेंट, हमको भी चेक कर सकता है. वाइटल साइंस हमको भी एनी अदर ट्रीटमेंट दिया है तो ओके, पेशेंट्स का टेम्परेचर पेशेंट को इंक्रीज है, we have to give the any other nursing care or drug we have to providing, and after that again we have to check the temperature. So हमको that is called it is effectiveness of the treatment. If temperature reduced, the treatment is effective. And to modify or change the mode of treatment, modify हमको changes for vital signs mean any other detect any other changes is there, then if you are suppose we are now one treatment is going on, then the vital signs is not any other changes is occur, we have to changes the this treatment. And a routine part of complete physical assessment, complete physical assessment के लिए routine part of the complete physical assessment also is a part of the purpose, and to understand the present problem. Okay, these are the mainly purpose of the vital signs. Okay, then first we have to check the first discuss about the body temperature. The normal body temperature of a person varies depending on the gender, recent activity, food and fluid consumption, time of day, and in women the stage of menstrual cycle. Okay, these are the reason to the temperature variation को होने का chances है. Where is depending on the gender, okay, male or female, recent activity, and food and fluid consumption, time of day, and menstrual cycle. And normal body temperature can range 96.8 degree Fahrenheit or equivalent to 37 degrees Celsius for a healthy adult. Okay, the person body temperature can be taken in any of the following ways. Okay, when you have to body temperature, we have to take in the, so method is there, then I will explain. Then temperature regulation center is a hypothalamus. अगर बॉडी टेम्परेचर में भी abnormal ड्यू टू फीवर, और हमारे बॉडी में टेम्परेचर अगर इंक्रीज हुआ है तो, ज़्यादा हुआ है तो दैट इज़ कॉल्ड फीवर. 98.6 के ऊपर हुआ है तो दैट इज़ कॉल्ड फीवर कंसिडर करता है. ए फीवर इंडिकेटेड व्हेन बॉडी टेम्परेचर राइजेस about 1 degree or more over the normal body temperature of 98.6 degree Fahrenheit. Okay, either we have to consider 1 degree, 98.6 के 1 degree ज़्यादा हुआ है तो we have to consider the fever, और 98.6 के ऊपर है, that is called fever. Then in our body, heat transfer in a body, there is a four mechanisms there. First is the convection. Convection means moving air remove radiate heat. Air फॉर एन एग्जाम्पल, फॉर फैन चलाता है तो हमारा इसी से हीट लॉस हो जाता है. देन इवापोरेशन लॉस बाई हीट बाई इवापोरेशन ऑफ वाटर. सेटिंग से इवापोरेशन हो सकता है, सेटिंग एक रीज़न है. देन ऐसे रेडिएशन मीन्स एमिशन ऑफ इलेक्ट्रोमैग्नेटिक रेडिएशन, मेनली इंफ्रारेड राइज टू हीट ट्रांसफर होता है. दैट इज मेनली 60% ऑफ द हीट ट्रांसफर बाई द रेडिएशन. This is conduction. Conduction is only 3% direct transfer by contact. If we are touching the any other area, so suppose we have to touching the any other cold water, okay, then in our body का temperature इसी से direct transfer होता है. That is called conduction. Then average normal oral body temperature, is 98.6 degree Fahrenheit. Very important. Rectal temperature is the 0.5 degree Fahrenheit to 1 degree Fahrenheit higher than an oral temperature. rectal का body temperature 99.6 degree Fahrenheit, oral से 1 degree ज़्यादा है. Axillary body temperature 1 degree Fahrenheit less than oral temperature. इसका 97.6 degree Fahrenheit. Okay, oral 98, rectal 99, and axillary 97.60 degree Fahrenheit. Okay, then method of measuring the body temperature is the orally. So orally temperature can be taken by mouth by using either the classic glass thermometer or the more modern digital thermometer, then use the electronic probe to measure body temperature. We have to check the orally. We have to check the body temperature under the tongue, the thermometer bulb placing. So using the mercury thermometer, okay, or digital thermometer we have using the rectal thermometer. Rectal thermometer is there. Then we have to check the rectally. We have to use the this temperature. Then axillary also we have to check this in the glass or digital thermometer. इसका root axilla 0.23 to 0.4 degree Fahrenheit lower than those temperature taken by mouth. Then by ear thermometer quickly measure the temperature of the eardrum, which reflects body core temperature, the temperature of the internal organ. Now core temperature means internal organ temperature. Okay, rectal and ear is a core temperature. So most reliable method of the temperature is the rectal temperature. Oral temperature we have to place in the 1 to 2 minutes. Rectal also 1 to 2 minutes, and axilla we have to place in the 3 minutes. 3 to 5 minutes we have to place in the area. By ear also 1 to 2, 1 to 2 minutes. These are the thermometer. Okay, Fahrenheit. These are the mercury thermometer. इसका मेजरमेंट देखो. This is the 96. 96 के बाद this is 97. These are the 98. Okay, this is 97. This is 98. 98. This is called, this arrow point is called 98.6. This is a normal value. And इसका ऊपर हुआ है तो that is called temperature. So it is called below temperature. Okay, then 98.6, then 98.8. This large line that is called 99. Then उसके बाद again it will be to 4 small line. The 4 small one line we have to consider 2. Understand? When 99.2, 99.4, 99.6, 99.8, then next this big line is called 100. I like that we have to place in the scale measurement. Even number mean we have to place even number, and odd number we have to place in the only for this big line. Understand? This 100 के बाद this big line is called 101 degree Fahrenheit. Okay. Like that we have to measure in the body temperature. So the temperature placed in the oral. Then it's mainly through 2 parts. This is a pulse bulb. First is this bulb system. Okay, before using the thermometer, we have to clean the before we have to matter science taking the before uh, taking the temperature, we have to clean the bulb to stem. Then after the taking the temperature, we have to clean the stem to bulb. It is also we have to clear the normand. These are the two types. These are called the stem thoda bhi length hoga. That is called oral temperature. And this the bulb. This bulb length, that is called oral. Bulb thoda bhi short hoga. That is called rectal thermometer. So these are the rectal. These are the oral. These are the difference of the oral and rectal thermometer. Another thermometer, these are the called mercury thermometer. These are the called infrared thermometer. Infrared. Okay, these are the called digital thermometer. The thermometer cleaning the solution before taking the temperature. The temperature solutions we have to clean the thermometer. Dettol ratio 1:40 for 5 minutes. Savlon 1:20 for 5 minutes. And Lysol 1:40 for 3 minutes. And Fahrenheit, this is 1:40 for 5 minutes. Mainly first two, Dettol and Savlon, for using the thermometer cleaning. The next is pulse rate. By the sense, the next is pulse rate. Pulse rate is measurement of the heart rate or a number of times the heart beats per minute. The heart pushes the blood through the arteries. The arteries expand and contract the flow of the blood. Taking a pulse not only measure the heart rate but also the indicate the following. So pulse rate is a measurement of the heart rate. Heart rate measurement करता है, that is called pulse rate. And heart rate is almost the same है. The number of time heartbeat per minute. So we have to measure the 1 minute how many times heart beating. That is called pulse rate. The heart pushes blood through the arteries. The arteries expand and contract with the flow of blood. अगर हार्ट हमारा बॉडी में हार्ट पंपिंग दी ब्लड, अंडरस्टैंड, उस ब्लड कहाँ जाता है, आर्टरी में जाता है. आर्टरीज एक्सपेंड एंड कॉन्ट्रैक्ट, ओके, रिलैक्सेशन एंड कॉन्ट्रैक्ट होता है बिकॉज ऑफ द फ्लो ऑफ ब्लड. सो दैट्स वी, thus we have to measure the heart rate. There is a mainly 9 sites of there. parietal pulse, temporal pulse, apical pulse, radial pulse. जैसे भी we have two types of the pulse. Nine type of the pulse is there. Then it is indicate the following is heart rhythm and strength of pulse. The strength of pulse is a normal pulse healthy adult ranges 60 to 100 beat per minute. The pulse rate fluctuates increase in exercise, illness, injury and emotion. Exercise, illness, injury, emotions mean the pulse वेरिएशन भी वेरिएशन हो सकता है. Then how to check your pulse? Using first and second finger, press family but gently on the artery until you feel the pulse. Okay, first and index finger or middle finger we have to fingertips press the arteries, place the arteries, then gently we have to press, then we can feel the pulse. So count your pulses 60 seconds. Suppose 60 seconds we have to assessing 1 minute, but normal patients, suppose cardiac patient is there, then we have to check the 1 minute. Otherwise, for normal patients we have to check the 50 minutes, then you divide it into the 4. Okay, 15 seconds we have to assess करना है, then into 4. Suppose पेशेंट्स को मिलता है 15 सेकंड्स में 20 मिनट है, तो 1 मिनट में कितना है 80 beats per minute. Like that we have to assess करेगा. Then when counting, do not watch the clock continuously but concentrate on beats of pulse. That is very important. When we have to taking the pulse continuously, not watch the clock, concentrate the beat of the pulse. So these are the checking the radial pulse. Most common to use the taking the pulse is radial pulse. Can be taken without disturbing or exposing the person. Okay, radial pulse, there is not patients, there is not disturbing. The first 2 or 3 finger or one hand against the radial artery. Okay, first 2 index or middle finger. Otherwise 3 finger also we have to using, just gently pressing the radial artery mean you have to against pressing. The radial artery is on thumb side of the wrist. Do not use your thumb to take a person pulse. Thumb not using. Okay, thumb placed in the under the wrist. The diagram they go thumb. So mainly we have to using this first 2 finger or first 3 finger we have to use in the pulse. Don't use the thumb. Okay, count the pulse में दिया है 30 seconds. Like that we have to press the pulse. Then next is what is the respiration? Respiration is a number of breaths of person take per minute. The rate is usually measured when a person is at rest and simply involves counting the number of breaths for 1 minute by counting how many times the chest rises. Okay, respiration means how many times number of breaths per minute, how many times the chest rising. Then we have to assess the respiration rate. Respiration increase fever, illness and then medical conditions में respiration increase होता है, increase होने के chances है. When checking respiration is important, is also note whether person has any difficulty in breathing. Checking respiration करने के check करने के time patient को check करना है any other difficulty is there. Normal respiration rate is 16 to 24 beats per minute. Like that we have to check the respiration. The nasal hand placed on the against the patient abdomen. Then how many times chest rises or abdomen rises. Then we have to check the respiration. So the next is the last is blood pressure. Okay. Blood pressure is the surface pressure inside the artery when the heart contracts and pumps blood through the body. Okay. Pressure, okay. artery में blood flow होता है. Then this blood कहाँ में this blood का the force of the blood against the arterial walls, that is called blood pressure. Pressure मतलब blood का pressure. This is blood का force में pressure है. This pressure against कहाँ में arterial walls against this pressure produce करता है, that is called blood pressure. Okay, refers to pressure inside the artery when the heart contracts and pumps blood through the body. This is mainly check the two parts hai, systolic and diastolic, and above the value is called systolic and below the value is called diastolic. It's measured by the mmHg. Okay, blood pressure is a force of blood pushing against the arterial wall during contraction and relaxation of the heart. Already told, each time of heartbeat it pumps blood into the arteries, resulting high blood pressure as it heart to contract. When heart relaxes, the blood pressure is false. Higher blood pressure means heart to contract, and when heart relaxes, blood pressure falls. Normal BP 120 by 80 mmHg. Like that, we have to, these are the blood pressure diagram. Okay, measuring the BP. Set the patient comfort to the heart level and to wrap the sphygmomanometer cup. BP apparatus ka name is called sphygmomanometer. Okay, this, and around the upper arm and inch above the elbow, just above the elbow. Stethoscope placed just above the crease on the elbow. That is placed in the part is called antecubital fossa, and pump the cuff around the 180 to 200 mmHg. Then listen to the stethoscope. Okay, stethoscope is placed in the antecubital fossa. Okay, then when we'll first hear the beat, that is called systolic BP, and last hear the beat is called diastolic BP. This diagram देखो. Okay, these are the inflated cuff. These are called brachial artery. Okay, so the brachial artery. Then we have to cuff is inflate किया है तो देखो, when cuff is inflated so that the stop arterial blood flow, no sound can be heard through stethoscope placed over the brachial artery distal to the cuff. cuff हमको 180 to suppose 180 to 200 तक we have to inflate किया है, then the completely the blood stop. देखो, okay, यहाँ भी flow नहीं है, यहाँ भी flow नहीं है, so no sound. Then cuff pressure is between 80 to 120. The Karato cough, इसका sound is called Karato cough sound, created by pulsating blood flow through the compressed artery. Blood flow through the compressed artery में we have to compressed artery में blood थोड़ा भी compressed artery में blood flow होगा. Then we have to just sound hearing. That is called, the first time sound hearing is called systolic BP. Then blood flow silent when the artery is no longer compressed. Okay, blood अगर complete relax हो गए तो no longer compressed. then यहाँ भी ब्लड थोड़ा भी कंप्रेसर आर्टरी में ब्लड स्टार्ट होता है. देन अगेन भी कंप्रेसर आर्टरी में सबसे लास्ट में कब ब्लड फ्लो स्टॉप होता है, सॉरी ब्लड कंप्रेसर आर्टरी में ब्लड साउंड स्टॉप होता है. दैट इज कॉल्ड डायस्टोलिक बीपी. दिस आर द एरिया. इसी वजह से वी हैव टू चेक. ब्लड कम्प्लीटली स्टॉप हो गए तो साउंड नहीं होगा, एंड ब्लड कम्प्लीटली फ्लो हो गए तो साउंड नहीं सुनता नहीं है. बट इसका भी कंप्रेस्ड आर्टरीज में वी हैव टू साउंड स्टार्ट एंड स्टॉप वी कैन हियर. These are the mainly vital signs. Everybody is got to understand, I think. Okay, we can see the next class. Thank you.